Hi, my name is Holly Duggan. I'm going to be doing my NG2 video. I'm going to start by washing my hands, but for the video purposes, because that takes a while, I'm going to use my hand sanitizer. I'm going to go into my patient's room and introduce myself. At this point, I would also provide my patient with privacy. Hi, Vernon. How are you doing today? Can I have your full name and date of birth? Perfect. So I'm going to do your feeding, but first I'm going to start out by doing a full abdominal assessment on you. If this was a new NG2 placed, I would send my patient to X-ray for placement. Are you in any pain today? Do you have any allergies? Perfect. Alright, Vernon, at any point of this abdominal assessment, can you just let me know if you are in any pain? My patient's abdomen. There's no lesions, no obvious protrusions, no signs of distension. I'm going to auscultate, listening for 5 to 35 clicks per quadrant. Now I'm going to percuss, listening for tympany. Now I'm going to start with a light palpation. Just let me know if you are in any pain. Just feeling for any masses. I'm going to go with a little bit of a deeper palpation. Still doing all right? Okay, good. Now I'm going to pull your Johnny back down. I'm going to raise your head up. I'm going to measure your NG tube to make sure it is still in proper alignment. Shouldn't feel any pain or discomfort at all when I'm doing this procedure. If you do, just let me know. We can stop the feeding and I'll let your primary care physician know. Alright, the tube is measuring at 39 inches, which is the same as what the previous nurse documented, so I know my tube is in place. Alright, I'm going to check residual and pH for my patient. Normal stomach pH is between 1.5 and 3.5. If I got any more than 250 milliliters of residual, I would stop and I would report the findings to the healthcare physician. So nice and slow. The gastric content on my patient should be light green in color. That is a normal finding. Got 120 mLs of residual. Just checking for the pH. pH looks like it's about 2, which is good for the stomach. Now I'm going to add my patient's residual back into their body. How are you doing? Now I'm going to flush with 15 to 30 mLs of normal saline. Now I can proceed with my feeding. The order stated that I was going to be giving Ensure 1.5 cal, and that's exactly what is in this can. I am going to fill the syringe up all the way up to the top. When 3/4 of the feeding has gone in, I'll refill the syringe. And if my patient isn't tolerating the feeding well, I will lower the tube with the syringe. That way it'll go in a little slower. Before pouring the Ensure into my syringe, I would make sure I wiped the top of it with an alcohol swab. How are you doing? Good. Now that my patient has gotten the feeding, I'm going to flush with 30 mLs of sterile water again. Right here. Alright. Now I'm just going to make my patient comfortable. I'm going to document my findings of this feeding, and I'm going to come back and check on my patient in an hour to make sure that he's still tolerating the feeding well. And as I leave my patient's room, I would wash my hands and lower the bed, give him the call light.